a special called meeting of City Council for Friday, August 20th at 2 p.m. It's the call to order. We're going to be discussing a letter of support to the Pickens County School District and the Governor's Office for the response to COVID-19. Also discuss an emergency ordinance for a mask mandate. I will start off, before we start our discussion, I will repeat what I said Monday night as well. I think one thing we can all agree on, no matter what, this is a very divisive topic. When we open discussions today, I want you to all understand that whether or not you agree with what is said, each individual in this council is truly acting in what is believed to be in your best interest. We have community members that are worried for their health, sometimes even their lives. We have people worried for our economy and their livelihood. There are many who just have opinions based on principle and what they believe to be right. No one on this council today is going to say all the right things. It's not possible, but please understand that we're saying things on behalf of other community members and things that other people believe just as strongly and passionately as you believe what you can do. Our goal is to try to find a balance that will best serve our community. So I will start the discussion up with public comment. We do have to limit, this is part of our rules at City Council, we do limit the total public comment to 20 minutes. Each person has 2 minutes. And so I will encourage to keep your comments as concise. It's a very passionate topic. We look forward to hearing your comments, but we will start off with public comment. So if you're here, we also have email comments that we will read as well. We also have a phone, we have a line to call in, 653-9886. Oh, that is correct. 653-9886. So anybody here at City Chambers that would like to speak, please come up, state your name, where you live, and like I said, please keep it to 2 minutes. Thank you very much. We'll open the...
Robert, let me interrupt. Can you hear me?
I can, Fran. Yes, sir.
Okay, thank you.
Comments?
Good afternoon. My name is Carrie Kay. I'm a resident of Clemson and a parent of students at Clemson Elementary and R.C. Edwards. I have 3 quick things to say. One is to ask you please to listen to the doctors in our community. I've heard through social media from Dr. Swan, Tolbert, and Gully, who are pretty unanimous on this topic of the mandate. I should say on the topic of the danger of the COVID spread in our community right now. Second, I want to say I can't find N95 masks for my kids that will fit them. And I was thinking about that, and I was thinking it's because nobody contemplated that we would send our children into active infectious disease areas. That's why they don't make N95 masks to fit my 7-year-old. Please think about that. I can't take steps to keep her safe in the grocery store, in the other places that you're considering, as well as in her school. I understand that only Clemson Elementary of the schools I mentioned is in your jurisdiction. And I've forgotten my 3rd thing. The second thing was a little too upsetting to me. Thank you for listening.
Thank you.
Is
your pen up there?
Thank you again.
Thank you.
Hello, my name is Daniel McFarland. I am 6 years old and I am a first grader at Clemson Elementary. I want everyone to wear a mask. I want my friends to be safe, and I want my teacher, Ms. Bowder, to be safe. I want you to make a mask mandate to keep us all safe. Please and thank you.
Maybe she could give that to the clerk. Could she give the written version to the clerk?
Thank you.
If we could, when you come up to the podium, please remove your mask so that we can understand you. It's a little hard to hear.
Sure.
councilmen and councilwomen. I'm here today as the mother of a child at Clemson Elementary School, as well as a registered nurse. The school board failed my oldest son, who attends R.C. Edwards Middle School. He does not feel safe returning to school without a mask mandate in place, so we are looking for safer options for him. Now is time for you to step up and be the heroes. Protect the children, teachers, and staff of Clemson Elementary. Per the district, vaccinated individuals do not need to quarantine if exposed unless symptomatic. There is still a chance that they can spread this virus to others, including the unvaccinated vulnerable children. Also, consider the repercussions of the COVID spread. The virus doesn't stop at the doors when the children leave that school. It spreads to family members, siblings in other schools, grocery stores, restaurants. Businesses are closing left and right this week in Clemson and neighboring towns due to exposures and positive cases. What happens when someone in our community needs to be hospitalized, whether it's for COVID or a heart attack or a car accident? They may be out of luck. There are only 100 out of 452 ICU beds left across all of Oconee, Pickens, Greenville, Anderson, Lawrence, and Spartanburg counties. There are only 4,500 PICU beds in across the entire United States. And if the trend continues and masks are not mandated inside school walls, 6,800 beds will be needed. Currently at Greenville Children's Hospital, the PICU is approximately 97% full. There are 11 children hospitalized at the Children's Hospital with COVID. Please consider all of this when deciding if you want to protect the town, the teachers, and these children standing before you today by issuing a mask mandate that will cover Clemson Elementary School. Not every superhero wears a cape. Thank you for your time.
Thank you. If you don't mind, again, stating your name too, if you don't mind.
Sure. Marissa McFarland.
Thank you.
And that was my son Daniel that spoke before me.
Thank you again. Other comments?
Hello, my name is Finn. I am 11 years old. I attend R.C. Edwards Middle School. The school district did not pass a mask mandate. Now I do not feel safe at school because I can't get my vaccine yet. Please help my brother stay safe in school from mask mandate. Thank you.
Thank you.
Thank you.
If you can, yes, that would be great.
Hi, I'm Renee Gahan. I live at 311 Upper Highland Drive in Clemson. And just want to speak to a couple things. I have some friends, and I know that there are a lot of people here who are also friends with this family who has a daughter who has Down syndrome. And at this point, she has to go to the hospital to get infusions because of COVID that she's contracted. Not only does the daughter have COVID from R.C. Edwards because she's a middle schooler, but the mother has also tested positive, so it's probably going to run through the family. And this is a breakthrough infection for the mother because, of course, she got vaccinated as soon as she could. There's another woman that I know, a nurse practitioner, and her son got COVID. He's 17, and now he has a heart condition. And he has to go to the hospital for transfusions because of his heart condition. There has not been any discussion about the long-lasting effects of COVID. And here we are taking a gamble on children just to see, just to let it spread and take its course, which to me, we are failing them if we do that. Unfortunately, the issue has been brought here. So another story I want to tell you about is another friend who contacted the school board. The school board said, we can't do anything about this. Get in touch with the state. The state says, we can't do anything about this. Get in touch with the school board. And then we're bounced back to city council. So people are playing hot potato over this issue, and it is time to go ahead and own it. And I know that the city itself has its limitations on what it can do, but I urge you to take that step. And I'm also speaking these things because I know that you're in conversation probably with people in the school board and county council and the state, and perhaps this can also be heard by those people. I appreciate your time.
Thank you. Okay. What number, Ray?
Last four digits, 9451.
Okay. 9451. If your last four digits.
This is Beth Bailey. My husband and I recently moved to Pendleton, and I feel like we're on the other end of the spectrum. We have very small children that are in a private daycare, and so while I fully support mask mandates for public schools, my concern is just how I'm going to get my 3-year-old to wear a mask all day long in a new school where she doesn't know any of the teachers or other students. And so I don't know if there's any wiggle room there as to where we could require it for public schools, but maybe leave it up to private daycares, because we haven't had any COVID outbreaks at her school yet. And then I also noticed, I was reading through your mandate, and there's a statement there that says any person that fails to comply with these requirements shall be guilty of a civil infraction punishable by fine of up to $100. So does that mean if my 3-year-old won't wear her mask at school, she's going to be fined for that?
And we'll be talking about that. I appreciate you bringing that up, so we will be talking about that just in a few minutes.
Okay.
Yes.
Okay, thank you very much.
Thank you.
8653.
Okay, 8653. 8653. If your last four digits are 8653, you have the floor. Rick, I'll look to you.
Okay, one more. 0216.
Okay, 0216. 0216. If you called in, your last four digits are 0216. You have the floor. Okay. That's all. So I'm going to read some public comments we also received by email. I'm going to name, if they're reoccurring the same points, I'll also state their names, but I'm also not going to be repetitive. I'm going to emphasize that I said the same thing. So I'll start off with, this is one from Nicole Starkey. I'm writing in support of a local mask mandate last year that, along with other safety mitigation strategies, managed to keep school going in person and the school community healthy. This year, with the schools being unable to mandate masks and decreasing social distancing of unmasked children, the spread of COVID has jumped. Last year, we used the Pickens County PCVA in order to prioritize the health of our children. With 2 of them now vaccinated and willing to mask and the safety protocol successful, we decided to return in-person learning last March, where we had to make a decision. Now, only 9 days in, our daughter is at high risk due to a series of medical conditions she's contracted through COVID, in spite of her masking and vaccination status. The school days consistently show that all 3 schools, Clemson Elementary, R.C. Edwards, and Daniel, that only 3 to 4 students voluntarily masked and only 1 student teacher's mask. The majority of the adults and the children encountered did not choose to mask. Your enabling a mask mandate puts the ability to create a safe environment back in the hands of the school leadership. Thank you for your service to our community. And again, that was Nicole Starkey. We also had a comment from Marissa McFarland. Can you please put masks in place? I'm 6, by the way. I miss my friends and teacher. Love Daniel. Daniel's mother, Marissa, agrees. Do the right thing, even if it's an unpopular opinion for some. You know masks work. You saw it last year in the schools. Stop making the innocent, unvaccinated children political pawns. You also need to protect the teachers who continue to go in those buildings day in and day out for the future of this town. Stand up and issue a mask mandate. Thank you, Marissa McFarland. We also had a similar letter from, I'm looking at it, I'll keep on going here, I'm sorry. Pam Warren, please help protect our children under 12 who are not eligible for the vaccine by making a mask mandate that includes Clemson Elementary. I'm writing as a mother for a kindergarten student. This is Melissa Ingersoll. Hopefully I'm pronouncing that correctly. I purposely kept my daughter out of pre-K to watch from the distance to see how the school districts would fare through the 2020 school year, and I feel like the district's did an amazing job under the circumstances. The data shows that the highest number of positive students at one time throughout all of last year was 85, January of 7th, 2021. While numbers continue to grow, as of today, 294 cumulative students and teachers have tested positive from 9 days of in-person school. Please impose a mandatory mask within the city so the local elementary schools will be obligated to do the same. Thank you for your time. There's just a few more. Please read the. This is very similar comments from Brittany Belmont. I respectfully ask you to reconsider the proposed mandates for ages 2 and up. And I could spend a lot of time on this issue, but I'll keep it brief. Young children do not understand about germs. Because young children do not have appreciation for germs, they also will not be able to properly take care of their masks. From a development standpoint, young children need to see the faces of their peers and caregivers. This helps from health attachment, teachers, social, builds trust and confidence, and helps with speech development. Okay, so as I understand this is a difficult position, but I ask that you please allow parents to decide how to best care for their children. We know and love our children better than anyone else and give us unique qualifications to make these sorts of decisions for them. Thank you for your consideration. Again, that was Brittany Belmont with her position. I would like for the city to issue a mask mandate. We need support in our schools. This was Emily Howell. And the last one that I have here that was submitted to us by email was Jay, and I will spell the last name Takeuchi, regarding a letter of support to the school district and the governor's office in response to COVID. I agree with authorizing the mayor to submit a letter of support to the Pickens County School District and governor's office. The school district did the right thing in choosing to move instruction online in the face of COVID spreading throughout the schools. Going forward, the school district should have the authority to make localized decisions about instructional modes, including moving online when necessary, about COVID mitigation protocols, including requiring universal masks. I urge the mayor and the governor to implement a statewide mask requirement. The city of Clemson must play a leading role in prioritizing public health over politicized today's unknown basis in medical science. Other calls? Any other discussion, comments?
Okay, I'll be the only dissenting vote here, I imagine, which I expected walking into this establishment. My name is Robert Kraft. I'm here more to discuss the fact of the idea of putting masks on the younger children. I'm not going to get into the politics of it. I do agree with the Lone email about it should be a parent's choice to take care of our own children, and I've had COVID personally. My kids did not get it because I did the right things to keep myself away from my kids safely. But for a 2-year-old to wear a mask at school is ludicrous, and to mandate that is even more ludicrous in my opinion. People can keep their kids home if they are that scared or fearful of it. I'm not going to get into what you can and cannot do in the city limits. That's y'all's choice to make from that standpoint. But, trying to take a business side approach to it, it's going to affect a lot of people. I would pull my kids. I'm not going to let my 2-year-old be running around a playground playing 100-degree weather. Technically, my child has asthma, so he wouldn't be able to wear the mask anyways. I'm here to fall on the sword of those that are basically feel bullied by, those that don't agree with them in this city. And if not me, then who would stand up and say it? I think it's absolutely ludicrous. Much like I also thought it was rather redundant. You read an email from the same individual that spoke and said the same words to the mic. I felt like you didn't read the same email from the actual same exact woman and her child, which I don't personally agree with using children up here as propaganda, in my personal opinion. But yeah, that's my name for the record, Robert Kraft. Please don't retaliate and affect my business and retail, because I know how this town reacts. But I don't think you should force any parent to make their children do things that is against their will at a 2 to 4-year-old level. I appreciate your time, and that's all I have to say.
And I also appreciate you drawing that to my attention. Thank you. From the repetitive side. Numbers, Rick? Any other?
My name is Sandra Garrett. I live in Strawberry Lane, so also in Clemson as well. I did my postdoc in 2006-2007 in the state of Indiana for the State Department of Health there with the CDC, looking at pandemic preparedness and mitigation, looking at alternative care site creation. Now, my PhD is in industrial engineering, so I do not know the epidemiology and virology side, but I do know how to read their papers, and I do know how to work with the medical side. I did healthcare systems engineering. We specifically looked at avian flu, so I know that it is different as far as the mortality rates, but the infectiousness of the Delta variant has me very concerned. When we worked with the CDC flu surge models, the types of infection rates we were expecting was lower, although we were looking at higher mortality rates. We specifically looked at PPE, we looked at quarantine, isolation, and other very similar situations as far as how to mitigate community risk. At that point, I never really thought we would get to this point of where we are today with the additional surges. We usually predicted things like 1918, where we had 3 flu surges. We are looking at many more than that as these variations continue. My request is that as we see this continue to mutate, we know that it will continue to change. We don't know what those changes will look like, but the more people that become infected, the more likely the mutations will occur. We need to reduce the number of people that become infected to reduce the number of mutations that are possible. Thank you.
Hi, my name is Tina Stokes. I live in Karen Court in Clemson. It's another aspect that you are not considering. I work with behaviorist children. I go to their houses and I do services for them. When they get exposed to COVID, we're 10 days to a month out of their house if they're not receiving services. I have a child currently in Central. I haven't seen him for 2 weeks because of exposure to COVID. And these are kids that are on the fringes. And because of COVID, because they're not being protected in schools, they're losing services. And so not just the school children, but all the mental health facilities cannot serve people if they're exposed. So please get a mask mandate in the city. Hopefully it'll carry over to the schools and we can all be safe and we can serve the children that need us the most. Thank you.
Thank you. So at this time, we are reaching our 20 minutes. I will give the opportunity if there's anybody that would like to say anything different or differently that has not been said in the past a little over 20 minutes. Please, this is your opportunity if you'd like to say something that has not already been said. So, and then we have one more caller. Okay. We'll wait on the caller. Rick, thanks. Okay. Yes, ma'am.
Hi, my name is Sandy Linder. I'm a resident at 123 Holder Street in Clemson with 3 kids at the elementary school in 3rd, 4th, and 5th grade. I'm also a professor of early childhood education at Clemson University and prepare prospective early childhood educators in Queens County and beyond. I have 45 seniors going into practicing settings starting on Monday in kindergarten through 3rd grade settings without a mask mandate. I can tell you in my personal and professional opinion that masks are a minimally invasive strategy for ensuring that children can be in school and ensuring sustainable growth and learning over the course of the year. What is not a good strategy is quarantining children who are maybe negative or positive but have to leave school and result in multiple weeks of learning loss if they are only quarantined once. My children are likely to be quarantined multiple times during the course of the year in multiple grade levels, meaning that I won't be working, they won't be in school, nobody's benefiting. So a simple intervention can help mitigate that, as it did last year. Teachers are able to do it. They did it all last year. They're doing it right now, and they're fantastic. Let them do their job. Have people wear masks. Let the kids stay in school.
Thank you. And Rick, you said the last 4 digits?
1266.
1266. Please state who you are and where you live. And the floor is yours. 1266.
Hello, can you hear me?
Yes, we can.
Okay, perfect. My name is Mariela Avalai. I am in 104 Pool Lane, Clemson, in downtown Clemson. I just, I wanted to add something similar to the last person, that I am openly open to share with the council members that people from education, physicians, people who specialize on child development have said that the damage for wearing masks is not real. So we are in a city with an elementary school. We need to protect kids that unfortunately don't have the chance to get the vaccine yet. So that was my only comment. Thank you so much.
Thank you for calling in. Great. Any other calls? All right. And at this time, we've been relying very heavily, and we appreciate our local physician, Dr. Swan, is going to come up and give us the latest update. The floor is yours.
Thanks for having me back. Oh, there's so much to say that I'm just not going to say it all. I'm happy to take your questions. I was kind of writing down a couple very brief things. My experience has been that masks have been very contentious. I know this is an incredible challenge. Just a couple of quick stories. Let me look at a picture where I wrote these things down. I passed these stats on to Andy a little while ago. But we've been, Clemson, it's really awesome that we have this test site because we've been able to gather local data. And the first 6 weeks of summer, we had 7 pediatric cases come through our test site. The week before school started, we had 11 cases come through the test site. After the first 9 days, we had 73 cases come through our test site. And then school shut down. And as you all know, if you're exposed to COVID, it can take a little while before you pop positive. And so since being closed, just in 5 days, there were 109 more children that tested positive. And I can only imagine what would have happened if those had all been in school this week. So those are some pretty impressive statistics. The team, our volunteer medical team that helps with the testing, and we try to call our positive cases. So we've been talking to a lot of parents instead of the children. And you may be aware, I don't have the exact details of this, but it was a 5th grade class at Clemson Elementary. And I think at least 8, and it might be more by now, students tested positive. And what's important, this is important because when we think about masks, certainly as a physician, I try to wear the best mask I can to protect me. And quality filters are helpful. Somebody earlier mentioned the challenge of finding a really good mask to fit children. Children are different sizes. But the person that they think started the illness in that 5th grade class was unmasked. Some of the children that contracted it were also unmasked. But one person that I talked to had their daughter in the best mask that they could have found. And they were doing everything they could to, be in person and yet make it through this environment. And she tested positive. The good news is that she had, at that point, a couple days in, an asymptomatic case. And so that does argue strongly, as what we've seen in research, is that anything that filters some of the virus away from you may result in a more mild infection than something that is severe. And so in cases where masks may not 100% prevent infection, they may help make the infection mild enough to where you don't have serious disease or serious complications. But the story of that 5th grade class goes to how we understand masks to be effective in mitigating infectious disease. And it is most helpful when you have the mask on the contagious person. And so if that person is wearing a mask, their ability to spread significant amount of virus into the air that children then rebreathe or adults then rebreathe is significantly reduced. So we call that source control. And as you remember, the problem with COVID is that people are infectious before they know it. And so you don't know who those people are until it's too late. And through the last year, we've learned about asymptomatic cases and minimally symptomatic cases, the type of runny nose that you would send your child to school with 2 years ago. And these are people that are potentially very contagious. And so the numbers that we've seen come through our test site speak to what happened when we sent our kids to school in person in an environment where we did not have enough masking. It's my medical opinion that you really can't have it both ways. If you want in-person school, you have to have masking. Masking works when you have source control. And frankly, the only way to get that is to have mandatory masking. Some of those cases that I mentioned to you were not just school children. Many of them are not yet in school, so very young children. So I think that's probably all I should say to start. I'm happy to answer any questions.
Questions for Dr. Swan? Questions for Dr. Swan?
And I can't speak for everybody, Dr. Swan. I appreciate you being here. I think I can speak for all of that. To me, the school is kind of a no-brainer. That they have the choice to be vaccinated and everything else. I think for some of us, the more difficult part of wrestling with is when you move beyond the schools vaccination. For mandatory face masks, where people have had a choice to be vaccinated and typically have a choice to be in there. So are there some changes in vaccinations, different things? Because I know that's where I wrestle hard with, is moving beyond the schools. I have no problem with one moving to schools.
Sure. I'm talking about this a lot, and it seems like I keep changing the story, or I keep upping the ante because I continue to underestimate this variant. So one of the things that is very important is to know that I think, Andy, there's a slide that was maybe as of yesterday, the number of people in Prisma Hospital, and it's 300 plus, and they highlight the percentage of the number of people that are in the hospital that are fully vaccinated. And with half of our population, or slightly less than half, vaccinated, the skew to who's in the hospital that's unvaccinated versus vaccinated is remarkable. Okay, so to that regard, we know that the vaccines that we have so far have been protective to help prevent hospitalization and death. We're seeing some numbers emerge that it's not holding quite as well as we hoped for, but it's still doing really good. But there is writing on the wall, and this is why you're hearing a lot of talk about boosters right now. And Andy, I sent another slide about waning immunity. I saw you have it up there, but it's a different one. It's got a curve on it. Nope. I'll just tell you if I see it. So in Israel, Israel started vaccinating their population before us. It's probably 6 weeks or 2 months, and they have a much higher vaccination rate. And so with Delta, they have had horrible surges, and some of the people, a lot of the people that are in critical illness and on ventilators have been fully vaccinated. And what we're learning about that is the waning immunity. Okay, and so we have many patients many elderly patients who were excited to get vaccinated and took that opportunity. 70 plus, I apologize to keep this is a moving number, 70+% of our elderly in South Carolina are vaccinated. But what we're finding out is their immunity is waning. And so without a booster, you're almost there. Yep, that's it right there. Yeah. Without a booster, most likely in time, we're going to see the protective effect from hospitalization and death, or ICU and death, start to go off. And so some of the environments that our more vulnerable patients are in may all of a sudden become dangerous again. And I worry about that. And I'm strongly encourage boosters when that's time. But that is a potential major problem on the horizon. And so while we are talking primarily about children today, I do think it is fair to bring up this point. Like I said, the writing is on the wall in Israel. And so the whole, if we can be ahead of the game to protect our neighbors, that would be wonderful. Just speaking about hospitalization, brought up one point that I didn't mention. With children and hospitalizations, being young is a blessing to your health. And certainly it's true for COVID that most children do well with a COVID infection. However, symptomatic children, some people with infections have longer lasting effects, okay? And the likelihood of having longer lasting effects is actually higher in children. So children that become symptomatic, about a third of them will have a prolonged experience with COVID. And so their 10 days is up, their fevers are gone, they're back in school, but they are not back to themselves. And so that's an important reality to acknowledge. And the hospitalization rate, I got a slide on this one too. The slide, if we find it, shows it's CDC data for the Southeast, and it shows the change in hospitalization rate. So again, youth is a blessing to your health, and hospitalizations in young people has been relatively low, but the degree of change with the Delta variant is stark, and so it is much different. It's alarming when you look at the graph. You have to remember that young people do better than most, but what it really speaks to is we do not have our head around this variant yet. And as I mentioned, I seem to always underestimate it. We just don't really know where it's going. And so I think, what is on the table today, I support. And Councilman Duckworth, your question, I think it's appropriate for us to consider a potential challenge to some of our vulnerable in the community who are really coming due for boosters. They really should be getting eligible, in my opinion, for boosters now. But as it currently stands, I think it's encouraged to be in late September.
Other questions for Dr. Swan? So
if they already have had.
So what I will ask, thank you. And we didn't put this in place, but if you don't mind, Dr. Swan will repeat that question. Thank you very much for that question. If you don't mind repeating it and then sharing your comments. But this is right now the time if questions from City Council at this time. So please.
So as I understand it, the question is, what is the rate of hospitalization in a child who comes down with COVID? And the bottom line is, I don't know the answer to that question. I was with a pediatric infectious disease specialist, the head of Prisma for pediatric infectious disease yesterday, and she knows that statistic. But let me just say that it's low. Okay, it is low. But with the Delta variant, it is higher, significantly higher than previous. And the potential effects of childhood COVID are not to be quickly dismissed. Again, as we're not even close to wrapping our heads around this variant. So the more infections we're going to see significant problems. I think I think maybe there's 8 to 10 children hospitalized in prison right now, with a couple of them on the ventilator. It's not good. Not what you want.
Appreciate you answering that. Any other questions? Dr. Swan, we appreciate your update. Thank you very much for coming in. At this time, comments from City Council. I will ask before we go to comments, I know that we had opportunity also Monday night to speak, comment, or share your thoughts. More than willing, but just keep in mind to respect what we're also asking from the public, to keep your comments to a concise time frame. So I'll turn it over to City Council. And again, we are discussing two different topics. We haven't talked about the letter of support specifically, but we are discussing an emergency ordinance for mask mandate.
Before making my comments, and there are other committees, but I do want to give, because I was at the Economic Development Advisory Committee yesterday. They discussed this. They discussed this topic, and the mayor was out there, seeing Catherine, one of the members there, and Andy was there, so y'all correct me if I get this wrong, but their encouragement was, as we looked at this, was their preference was a school-only mandate. Then from there, it was exclude non-essentials if you were going to have a mandate beyond the schools, and those essentials pretty much defined as what was on the draft ordinance that went out. So I just wanted to share that before there was any conversation also. There's a report from that committee.
And if you didn't hear what you say, it's the City Economic Development Committee that meets. It's a very diverse group of business owners, residents that met yesterday afternoon. So thank you, John. Other comments? Fran?
Yeah, so I was going to bring this up. This may not be the right time, Robert, but first let me say that I got 28 emails from people urging us to pass a mask mandate. 28. I got 4 all business owners or related to business asking us to not do that. So I appreciate what you read, but the overwhelming proportion clearly want us to have a mandate and have it now and step up and do the right thing. I do think, and John sort of alluded to this, that there really are two different things going on. One is the mask mandate is related to school district, and one is the city. I don't think they actually differ. I think both are layers of protection, both address the issue of source control. So I do think both those need to be passed, and I'm opposed to any accommodations that weaken that. But having said that, I'm going to suggest, and this is what it may not be time now, that we actually divide the question, which Robert's rules lets us do, and first discuss the mask mandate in schools and make a decision on that, and then come back to the more general community mask mandate. And the reason I say this, and my strategist told me this is a bad idea, is I'd hate to see the city mandate get in the way of approval for the school mandate. My sense is that we're going to be strongly supporting the school mandate. I hope we're equally supporting the citywide mandate, but I hate to see our squabbles and disagreements over the citywide mandate hold the school mandate hostage. So proper time, I will recommend that we vote on, I think it's dividing the question or severing the question into two separate issues, two separate questions. Frankly, even listening to Dr. Swan, I'm more convinced than ever they're not separate issues. You can get COVID in the grocery store, in the bar, in the classroom, in school. You can get it anywhere. It doesn't know the difference about where it's transmitted. It's an evil beast that will attack anyone. And I think we need full coverage, but I'm willing to say, maybe it's going to be easier for us to separate the two. It's a bad strategy, I think. I think it makes it too easy to say no to one and yes to the other, but I think it's necessary. I'd hate to not have the school mandate pass over our disagreements about a city mandate.
Thank you, Fran. And I'm actually going to look at Mary to make sure. I think at this time we can't go into policy action based on, unless there's any discussion on the first. I'm remiss to, we actually have the item on here to discuss the letter of support. Rick, can you put that up there? Do you mind the letter of support that we discussed on Monday night? Is the agenda item, can you put it up on the screen? It's on the, it's through the calendar, please.
I think procedurally you might entertain a motion to consider this in a second, and then any amendments would take place after that?
But
Any
that would be
additional
through
discussion?
through our policy or you discussion?
I'm sorry.
Policy action or reports and discussion?
I'm confused as to what section we're actually in
So-
right now.
I think we need to do that.
That's what I'm saying.
Oh, we're still in reports and
Yeah, we're
discussion.
still in reports,
Okay.
and that's where I was like,
So-
don't confuse me, man.
I'm the one that's confused.
Don't confuse me, please. So, Rick, I'm going to read the letter just to make sure, and I'm going to, we will be discussing both these policy actions. I'll repeat the policy action. Consider authorizing the mayor to submit a letter of support Pickens County District and submit to Governor's Office for response to COVID-19. Also, the second item is consider approval for emergency ordinance for a mask mandate. Since the discussion has been, the majority is the emergency ordinance for a mask mandate, I assume, and I'm looking at Mary, our city attorney, that we can move that up in the policy item, move it up one, and then talk about the letter of support afterwards.
Yes, I think that's
Okay.
right.
Yes?
Yes.
Okay. So we're going to start, I will repeat, since we're still in reports and discussion, then we'll move into policy action. I'm going to read that letter so everybody's familiar with what we discussed Monday night. And I was trying to look it up in my folder here, but Rick, I'm relying on you now. If someone else has it, I'll read it. It should be attached. Was it not attached? Yeah, it should be attached to the meeting. It was. No,
It's on the 20th.
yeah, it should be on today as well. No, and then it was on the 16th. It's on the 16th, sorry, Rick. And then we'll move forward to policy action.
But the vote on the 16th, no, John had made some.
We made a change, mitigating.
But I don't know if it's on the 16th.
That's all.
We okayed it on the 16th
I
too.
thought we did too.
That's what I was.
Well, we added it today to get verbal. So I just want to read it again. That'd be good before I do. Take this.
It is on there.
Okay. All right, well, we're going to go straight into policy action. Like I said, we're going to start with consider approval of emergency ordinance for mask mandate. That'll be item B. We'll move up to item A in essence. So at this time, we're moving into policy action. So, discussion from City Council.
I'm not sure I follow what Fran was saying there again. Fran was looking to sever this and let's have two votes.
He would need to make that. You would need to make that motion.
That's
now
what he
that
was
we're-
trying to make as a motion. Was he making a motion or he was?
No, he was saying, I think that it was an option because there seems to be agreement on the schools, but not, he didn't want it to get bogged down in the discussion.
I just had a hard time hearing.
If that is something that this would be his opportunity in policy action to split it up.
Well, for now, if you're in policy action now, then you will need a motion in a second to discuss the
So,
So, Fran?
So Robert, let me make a motion. Mary's going to have to clean this up a little bit. And again, this is Robert's rules allows us to do this. So the motion would be to divide this motion and consider two separate pieces of business. First one would be the content related to the schools, preschools, kindergartens, and daycares. That's section D and what follows. So I'm suggesting first we deal with the section D part, and pass it or not. And again, that's the school mandate. And then come back to the first part, which is the more citywide with the essential, non-essential concepts, which I think we'll have more disagreement on. But we would basically make this two pieces of two different motions, I guess, Mary, if that's the right term. First one being the school-related, and then the second one would come back to the more general city-related with the school-related, essentially beginning with section D plus whatever boilerplate fits with that. And so I guess that's maybe not stated quite concisely, but that's what my motion would be.
Motion, Fran, do you want me? So do you want me, Mary, do you want to help clarify that motion?
Okay, my understanding of the motion
You want
is to sever,
Mary, do you want?
sorry.
That's all right.
Is the motion is to sever all the applicable sections related to schools and that would include schools, preschools, kindergartens, and daycares, and into a separate document, and that would be fairly easy for me to do quickly. And that the sections related to requiring masks in essential locations in the city where people have to go to perform necessary daily tasks would be considered in a second motion. Is that correct, Dr. McGuire?
Right, and both would be debated, both would have to be voted on, but that's correct. Thank you, Mary.
Do I have a second?
I'll second.
Okay, further discussion?
So on the schools, and again, I support the schools, to me, kind of the question is the age things. I mean, what are our expectations of enforcement for 2-year-old, 3-year-old, 4-year-old? Let's just kind of set the playing field.
I can address that. I included a section in there that if a person has a problem donning or removing a face mask by virtue of age or disability, that the mask ordinance would not apply to them, and that would be included also in the school section. CDC recommends that children 2 and older wear masks, and that's certainly something that's been adopted by DHEC as well. But I think that, we're not going to go out there and police 2-year-olds. But I do think that if they're in the school setting, if you have children who are able but are refusing to wear masks, then that's something that we would have to address with their parents. But I would leave enforcement matters up to the chief.
And I think we also remember, I'm sorry.
Let me add one more thing. I think one of the speakers said he didn't want his kid running around the playground. This is for indoor locations. So,
Thank
just
you
for
for
that.
clarifying that. Who was the first? We're going to Elisa.
The only thing I would add, I would prefer to keep it as one document, one ordinance, rather than separate the two, because it could become, I think, it's already complicated as it is, but I think if we keep it as one document, then it does not really give the school district, we're not actually singling out the school district, it's a municipality ordinance. And so I think for our school districts, then they can feel more comfortable enforcing it because it's for our municipalities. So it's the essential, I do like essential businesses. I'm not saying that we have to do non-essential businesses. I do think those places that we've identified should have a mask ordinance because the choices are very limited. Those are items that people have to have or need, such as your medications, your groceries, your items just to survive. So I think that speaks well to still have that mask ordinance, but I would not support or believe that it's important to separate the two. I think we should still have the way that it's actually been presented is the way that I think it should go, because the more the times that you have the separate ordinances, it can sometimes become confusing. So I think it's a municipal ordinance. The other part of it is I do like the suggestion that Mary talked about is that we come back and review it every couple of weeks or so, because to Dr. Swan's comment, we all are underestimating this variant. We're hoping that we're in a better place, but here we are once again. The numbers that Mary sent us earlier today, just from 18, that is very concerning. So I think we're all underestimating the danger of this variant. And if we don't do something, I can't remember the resident that spoke, but there could be new mutations that we're going to have to address. So why not do what makes sometimes us uncomfortable if it's going to protect us in the long run, so that we can get back to some sense of being in a normal state. So that's where I'm.
And John, I'm only going to take 10 seconds. I would recommend every city council meeting on a routine, if that's the case. That would be me.
I got two items or two thoughts, and I guess this is a Mary question or somebody, maybe a Jerry question. If we, by separating it, are we diluting the value of it as far as from a municipal perspective as far as the schools? Because right now I think everybody's in lockstep who can protect the schools, but I don't want to dilute it and I hadn't thought about it until you brought it up, Alicia, that we might in fact be diluting it by separating it that way. So I don't want to in any way dilute that message. The other thing was about the small children. We've heard several people comment about the inability to truly have the young children wear the mask. And I'm talking about preschools, those types of situations. And I don't know how we exclude those, but in addition to this gentleman who spoke earlier today, we've had a couple other emails, one from the church, the Methodist church. That lady that runs the Methodist, I think he had the name right in a second, but I mean, she was talking about the difficulty of trying to get a 2 or 3 year old to keep a mask on throughout the course of a day. So I think we are setting ourselves up to fail there, and I question why that really is part of this ordinance.
What I wanted to say was changed a little bit. Yes, I thought that it would be easy to do it all at once because I thought there was an agreement, but apparently there's not, given young kids. I think the purpose of the young kids is twofold. Number one, any additional person that we can have wearing a mask is one person who is not transmitting the disease. That's how I feel about it. I don't expect a 2-year-old to wear a mask from 8 to 5 in the office. That's not what we're asking 2-year-olds to do. I do think that what it does is give teachers the ability to make that judgment for themselves in their classroom and to keep their kids safe. And that's what we want. We want them to have that ability and that flexibility. And maybe it's only for 15 minutes for 3-year-olds while they're doing whatever 3-year-olds do in the morning. Say good morning to each other. And it's not, again, 8 to 5. So that's what I think. I also think that it helps get them in a habit because I don't want to think this, but I don't know where we'll be when they're 4. So I agree with Alicia. It'd be great if we could agree to do this without splitting a whole bunch of hairs. That would be outstanding. I just do worry, to Fran's point, that there's going to be hair splitting. So whatever moves us forward to a mask mandate, I'm in favor of.
Mary, is there anything legally that would put the ordinance in jeopardy by it being divided? Even though I get it, it's not just the public schools. We have said private schools and other schools as well. So even by dividing it, we're not just targeting the public school system. But is there anything in your 3 minutes you've got to think about it that we would be jeopardizing the validity of that ordinance if we do this split and it's not a municipality-wide thought process?
I think you could do either way. One thing that I've never seen was the statement put out by the Pickens County School District yesterday that said, please note that municipalities within Pickens County could enact ordinances that require the wearing of face coverings in public places. SDPC will honor those laws and ordinances for mask wearing and social distancing as required by these regulations. I've never seen a school district do that. And I interpret that as a plea for help. I'm sorry. Maybe I'm reading that wrong, but that's the way I read that. Okay. If you keep the ordinance all together, I included a severability clause. So if by chance a court were to strike down the municipality's right to create an ordinance, it would not endanger the rest of the ordinance. So from that perspective, I think you're good. If you do it separately, then you don't even have that worry. I would have a severability clause in both. Okay. But basically, it means if any part.
And you're not concerned about like a crazy state legislature person like Jerry Carter, coming at us and saying that's inappropriate. Okay.
No, I did include. I don't think this is a public school problem. I think this is a children not being able to be vaccinated problem. So I do think it's appropriate to, and if you separate out schools, we have a lot of schools that people with small children, without small children in our town, are not even aware that we have. We have Montessori school, we have Episcopal Day School, we have daycares, we have Little Lights Learning Center, and we have a lot of schools in town, and those children are just as vulnerable as children in public schools. So I don't think that I think a municipal ordinance that applies to all locations where children are for the greater part of the day is appropriate for a municipal ordinance.
And then my only other comment is, my thought is that, the law is about doing things within reason, and I think when you're talking about that 2 to 4-year-old preschool age, it's do your best, and do what's within reason, knowing that it's not going to be perfect but doing our best is better than nothing.
I think that's fair. I mean, those children are at the age where they're learning to sit quietly for a few minutes at a time, where they're learning, they're just learning basic skills. And unfortunately, this may be a basic skill for some period of time. I don't know how long. And if it's not, then, maybe they learned, maybe 10% of them learned it, maybe 80% learned how important it is to wear a mask during the pandemic. I'm still learning. So I think that's something that children can learn. And I don't think, I don't see a child at 2. Teachers had to do this during the pandemic earlier with a little bit older children. I think they apply that same skill set to younger children and just keep working on it, because no child is going to be perfect in that age range at anything.
So, Robert, let me go back to the motion that's on the floor and just share my thought. And I'm not sold on this, but my worry is that at the last meeting, at least one council member said, if we don't identify some of the businesses as non-essential, I'm not going to approve any mandate. And so my concern is, as we nitpick, or whatever you want to call it, all the items that we agree or disagree with, that at the end of it, someone like me might be in such a smit that I decided to vote no on the entire mask ordinance. I don't think anybody wants that to be the result. But if people are really convinced that unless certain things are included or excluded, they're going to throw out the whole mandate, a classic, baby in bathwater, I would rather us have a structure that makes sure that the school mandate's approved. Now, if no one is sort of the same mind, that's fine. My concern is that in our disagreements, we might get so upset, angry, concerned, it doesn't meet what other people want us to do, that at the end of it, we have no choice but to vote no on something I believe we all, at this point, realize we need to vote yes on. That's the only way. I don't think it hurts it, Alicia. It may. I don't think it negates it, but I think it assures that at least that piece is going to be approved. And I don't think that's enough. I don't think it's near enough. And I'm not going to hesitate to make my point known. I would hate to have the attitude from any of us, myself included, that if I don't get my way, or even if it's something you're so concerned with or so much believe it's necessary, like the essential, non-essential, that it will drive you to vote no when we vote on the whole ordinance. I think that's a serious error for the city of Clemson. We're forcing the mandate for the city to drive the mandate for the schools. And I think that's going to be it might be a mistake, and I just hope it's not. So I think we need to vote on the motion on the floor and then move forward. But honestly, that's my concern, that we're not going to approve that key school part because we get so angry, upset, or dig in our heels so much that we vote no just because other pieces were moved out that we think should be in there. That's why I think yoking it might be a mistake. Maybe I'm underestimating myself, but I don't know.
Procedural question, is there any reason that if we pass a school mandate, we pass a city mandate, that we just can't make a third motion to combine them back into the original state? Okay, we can't do that.
You can do that.
You can.
Yeah.
So also,
there
we go.
If a motion
if we don't want it to be confusing and all of those kind of things, at the end.
If a motion fails, I think anybody on the winning side of that motion can make a second motion for reconsideration. And I say winning, the winning side of the vote, not the winning of the passing of the motion. But you can always make a motion for reconsideration during the same meeting or the next if you have a term that's longer. But you all have one day terms, so you could do that.
Okay. All right. So unless there's other discussion, there is a motion on the table right now to only include item D in the current ordinance mask mandate that was drafted out there on the agenda item. It's item D.
Plus the applicable sections that would apply to that requirement.
Right. So,
Call the question.
Okay, we're going to call a question. So, all in favor of the current motion that's on the table, raise your right hand.
Robert, can I clarify very quickly before we vote? This is not to approve that. This is only to debate it separately.
Only to
Yeah, it's to put it on there, and then we'll have additional discussion if that's correct.
Okay, I want to be clear on that, yeah.
All in favor to add the separation, to split the current motion that's on, well, not the current that's on the policy action. All in favor, raise your right hand. Fran?
I vote yes.
Okay, thank you. Sorry, you have to do the verbal. Any opposed? Okay, now further discussion on that. Now that it's been split, item D. And Rick, will you put that up there, do you mind? Just to make sure. Right. The draft ordinance, item D.
And I think with D, you gotta remember E, F, G, H, all kind of flow with that.
So I keep on saying item D, but it's E, F, G. Well, I'll verify.
Item D plus all other applicable sections.
There you go, thank you. Thank you for clarifying that. Further discussion. And Fran, I cannot see you at this time. So if you have your hand raised, you'll have to verbally tell me.
You gotta go to the other one.
Thanks. Robert, you're the first person who regretted not being able to see me. Thank you very much.
Rick's gonna, he's just gonna, if anybody, I'm just making sure everybody has access to it to see it when he scrolls down. So, yes.
The only thing that I'm uncomfortable with is the fine of up to $100. I'd like us to set an amount for that. I personally would like it to be $100 for it to be a deterrent, and potentially give an option to have that fine reduced if you produce a negative test within a day of receiving the ticket. Would be a way to reduce that fine, or just do away with it on your first offense.
Is Chief here? He might be the best person
He's
to
at the
address
back.
that.
Here he is.
He's coming.
Good. I'm good.
He knew it was just a matter of time.
Here he comes. Thank you, Chief.
Thank you. As far as the fine amounts, I'm not exactly sure what the allowance will be by law. But I think logistically, we haven't had a discussion about this. Police officers reducing or tearing up citations shortly after issuing them is problematic because we had done a legal service. We have to go through the court to remove it. So if we put a provision like that in there, we just need to work with the court. So they'll have to come present it to court to have the ticket reduced or something. We would have to work with the judge and all of that. Otherwise, any other type of citation that we issue and immediately get rid of could lend itself to impropriety.
The up to $100, I mean, typically your ticket would, if you put it in law track that way, your ticket's going to be $100. And then the up to allows the court to reduce that fine as he or she sees fit. And that's true on most tickets.
So that gets at what kind of the spirit of what I was talking about, that it could be reduced if someone does come.
I mean, if someone comes in and says, I'm from Kentucky or somewhere, and I didn't even know you had a mask ordinance, and no one came up and told me, the officer was the first person to tell me and then issue the ticket. I mean, that might be something that the court will consider.
Yeah, and again, I think this is, again, reasonable enforcement. You know, if it's someone complies, they didn't know those kind of things. If someone's being obstinate, you know, about absolutely not causing an issue, that's when the ticket.
As far as the $100 amount, I looked around at the different mask ordinances, sort of towards the tail end of the first surge, and then I looked at what City of Columbia and had put in their ordinance, and it looks like there is a trend from the $25 originally to the $100, because I know that our officers had a lot of people say to them, well, I'll just give you $25 and I'll keep going without my mask. And so there is a trend towards a little bit higher fine.
You know, the only thing I don't know, because I'm new to the state, is what the legal restrictions would be on what a city can fine somebody civilly without it being a criminal violation. And that's part of what came into play in the first round of mask ordinances and was restricted by emergency order. And so
We did not, in the proposed ordinance, declare this to be a misdemeanor. It's a civil infraction. Oh, gosh, sorry. I'm so used to wearing it all day that I even forget about it, which is kind of disturbing in and of itself. let's see, where we're going, tickets, oh yeah, there's no jail time, and it's not declared to be a misdemeanor, so I think we should be good on that.
I was actually opposed to the $100, but I asked a student this morning when I at the Lutheran ministry, and they actually told me that when it was $25, they carried $25 in their pocket. They literally verified what you just said, and he felt like it should be more.
Well, I was downtown before, and the students routinely would make comments. If I just gave you $100 for the night, could I just walk around with a mask on? I mean, that goes to show you how the $25 incentive addressed the issue. But on the flip side of it, there are students that $25 may be challenging in getting food that week when you take that out of their pocket. So there are both sides of the spectrum, but the vast majority, that was the issue.
And they can always, if there's an inability to pay, they can always work with the court. The court can set up a scheduled time payment or can reduce the fine as might be appropriate in a particular situation.
Other questions, discussion?
The only other one, and I know that we've talked about this, I still am very concerned about, I mean, we're going to just give a wink and a nod to the 2- and 3-year-old situations. I mean, you know, we're very clear on how we state this, but yet we're going to kind of say, okay, turn your head. And then the other question I have, and I'm certain, I hope there's some teachers here, I assume they are. So who's going to enforce this in the schools?
The school district has indicated that they will cooperate. I've specifically put in there that they cannot use their time or money or salaries to do that. And so enforcement would be up to the chief to do the planning on that. If we get reports from third parties or from teachers who might make a report on their own time from their own equipment, that would be something that the police would be responding to, I think. But I'll let him address that.
Chief, at this time, I think it's good to, I mean, obviously that's been a concern of mine as well from the enforceability on anything we've discussed as a police.
So enforcing this on children, I equate this to the same thing as enforcing laws on children. There are specific reasons why children are handled differently in the court system. And there's a huge concern I have if there's an expectation that a police officer is going to enforce a civil infraction on anyone under the age of 18, because that's the way our laws go when it comes to that. There are crimes that children under 18 can commit, but we also recognize their brains are not fully developed. They may not be making the right decisions based on physiological reasons. So I have a grave concern if anybody thinks that we're going to be able to enforce this on someone under 18. If we're trying to encourage the schools to do it, it's not police engaging with juveniles that should be our focus.
And I don't think that's the expectation at all, and I do believe that it says in here that parents will be responsible, and again, from a reasonable standpoint, trying to do this. Again, it will be the parents, the student that comes to school, and parents are refusing to have that child wear a mask. That comes back on the parents. We don't expect anyone to be, police to be involved with 9-year-olds that are not wearing a mask. That's the responsibility of the parent.
And every adult that's present in the school, too.
Lacey.
Also, I think it's important to remember it gives teachers, other personnel, opportunities to say, this is the expectation, this is what is required of our institution, in that we're asking you and wanting you to put a mask on or being able to wear a mask. I do realize and understand children that are 2, 3, 4 years old. I have grandchildren that are that young, and trying to keep a mask on them is almost impossible some days. However, they do start to understand the importance of protecting them. They can wear the mask for so long a period of time, and then they take it off. But I would rather them be uncomfortable, wear the mask for a short period of time, than to be sitting there worried about what can happen to them because we didn't take that time. So I think it's important, as Bob said, that it just gives teachers it gives other people an opportunity to say, this is something that is expected, and we give them that ability to do that. Right now, when we say strongly encourage, that's a hard task, but if municipalities, we say this is required, then that gives them some leverage. So I don't expect you all to walk in.
One last thing. We got to remember that the school district has really begged us to do this. So I think it's there. They'll figure out how to enforce it. It's not. I think it's really not on us to try to figure that out.
And I want to clarify, my comments were not targeted at council's expectation. I was responding to an earlier caller that asked if a police officer was going to issue their 3-year-old a citation, and that was where my comments were coming from. But I would also like to point out that there are some circumstances where a juvenile may get a civil citation for not wearing a bike helmet or committing a bicycle infraction or something along those lines that we would get involved in. But most of what we do in the school environment is to work with the school officials for the school to handle it, and we don't get in the middle of it. And if it gets to an extreme where the child is not doing it because their parents told them not to do it, then that's a decision I think the school needs to weigh in on, whether they're going to allow the student to continue to be disruptive in school and either find an alternative place for them inside the school or outside of the school to continue. And if the parent comes up to the school and raises Cain because of that, then that's a different set of circumstances that's probably not going to be a civil fine.
I'm just going to echo and Chief touch on a lot of what I was just thinking there. I view this as a tool for the school. The police actions I view as any other issue on campus when they're called in accordingly. I don't think they're going to be patrolling the halls. And, you know, I struggle with mask mandates, period, anyway. Y'all know that. So, but the school, I view this like when we put the first one in, it was because people couldn't be vaccinated. These children cannot be vaccinated. And in Pickens County, you know, our incident rate is 1,117 or something per 100,000, a little over 1%, which isn't a lot, but it's growing rapidly. But of that, 37% of them are children 20 and under. So I think this is appropriate. And I appreciate Fran splitting it out, because I do think that makes it a lot easier that we can all, hopefully all be on board with that. So.
I'll just, Maria, I would definitely say the same, what you just said, John. So unless there's any other comments, discussions at this time, there has been a motion that's been presented. Well, actually,
There's no
not
further
yet.
motion.
Would somebody like to make a motion? Sorry, you're keeping me straight, Mary. I appreciate it. Oh, okay. Yeah, we actually, at this time, we're in policy. So, thank you.
I move that we approve the mask mandate for school districts and daycares as written.
Second.
As separated out.
As separated out in the
You need to-
motion.
I mean, I would clarify what's been separated out.
The Part D.
Part D and all applicable sections related to Part D and pertinent to Part D.
There you go.
Because there are some things after Part D that apply to all the previous sections, right? Like the $100. So I like the way Bob said that.
Yes.
Okay, Catherine made the motion. Do I have a second?
Second.
Fran seconded. Okay. Any further discussion? All in favor, raise your right hand. Any opposed? That passes. And now we'll go to the further discussion now on the draft ordinance that's on the agenda item without the schools. Well, we're talking right now without the school section part.
We'll go ahead and entertain a motion and a second to.
Yep, if somebody would like to.
I'd like to move that we consider the mask ordinance for the city as presented with Section D removed. Section 4 schools.
Second.
Okay. All right. We have a motion. Any further discussion? Oh, sorry. Any further discussion at this time?
So, Robert, this is Fran.
Okay. Fran, thank you for doing that, because, I can't see it, but I am going to keep on recognizing. I appreciate everybody's patience. I'm looking as quickly as I can, so Fran, go ahead.
Okay, so I'm going to speak against this non-essential, essential dichotomy. If I read this correctly, what this now means is the only places required to wear people are required to wear masks are grocery stores, doctor's office, medical offices, and I believe some banks. The places they're not required would be everywhere else. And I just made a list just for fun. Spas, hotels, real estate offices, computer stores, GameStop, telephone stores, car repair, car wash, bicycle shop, running shoe shop, coin shop, tanning salon. Basically, everywhere in Clemson would be fine and not under mandate except, as I say, grocery stores. I think some banks, I think most banks meet the requirement, and medical facilities. Dr. Swan's term that he used is just wonderful. This notion of sort of source control. If we don't do this in a greater number of places, we lose the notion of source control. My other issue, and I've said this before, if you get COVID when you walk into a bar, that doesn't mean when you walk out of the bar you no longer have COVID. It means you can infect, based on the number we've seen, 7 more people. Those 7 people can infect 7 more people. Those 49 people can infect 300 and whatever people. So within 2 iterations, the COVID that is caught, or whether the term is a non-essential place, will savage, including kids who go anywhere. So the notion that somehow COVID will respect the essential, non-essential dichotomy is just false. It's not going to happen. COVID will travel at its will. It's a mean beast who looks for willing hosts. And I think by not mandating masks everywhere, it is in fact going to free the beast. And I got to tell you, just as an example, I looked up this morning at the Hotel and Restaurant Association, and I'm going to read you what the Hotel Restaurant Association said. We will continue to require masks of unvaccinated people, face coverings of unvaccinated people. So even the professional organization for the hotels says they will continue to require guests who are unvaccinated to wear face coverings. Now they also say, out of fairness, that it's an honor system. But even that professional group in hotel and restaurants, rather, recognizes the danger of telling people you don't have to wear a mask. Now, we don't have the fortune of differentiating vaccinated from unvaccinated, so the answer to me is masks. To not do that ruins this notion of source control, doesn't put layers on it. We've already, from the last iteration, for instance, allowed bars and restaurants to have people take their mask off while eating and drinking. We've made other accommodations. Maybe we can think of other accommodations more specific, but right now, we basically have opened the city and said no mask except in a very few places. Essential, non-essential is meaningless because COVID doesn't respect that dichotomy one bit.
And I'm gonna reiterate, and I think everybody on City Council knows that this is a very important discussion, but we need to follow our City Council rules with 5 minutes. We have been discussing this. If you have something new to say, absolutely. I'm going to reiterate that again for our City Council's sake. And if anybody in the audience would like to leave based on what's already with the schools, please let me. You're more than welcome. We just want to make sure, for sake of people's time, we understand families first, always. So, and I think, who raised their hand next? John or?
He had his own morning.
I'm fine. I want to hear.
Catherine. Yes, sorry.
In this, Fran, I agree, but I'm going to split a hair here, just that I'm going to do, which is we also just agreed that we were going to revisit this every 2 weeks. I've thought about this and I've read the emails from the business owners, and what I would agree to is this current definition of essential, on the understanding and hopefully the support with other business owners understanding that if numbers do not change or get worse in the next 2 weeks and then 4 weeks, that this would expand. And what I hope this does is for the business owners who told me they weren't going to enforce it, they weren't going to wear masks, they weren't going to ask anybody, that they consider that we can expand this. So that's where I am on this. I'm taking the bell curve approach that if we can be on the downside, then that's great. If not, then we do have the option to expand. So Fran, that was my compromise as I thought through what the right answer might be.
John.
There's a couple things that I'd like to clean up about And I don't know what procedurally how we do this, but I think when we got into the essential, non-essential, we'd initially talked about grocery stores and pharmacies and the medical. Banks, for example, most everybody who banks these days probably does that either online or through an ATM, so I question why banks are mentioned. And as far as the other retail, for example, other retail stores containing groceries, etc., truthfully, all of those others, quite honestly, are places you can enter by choice. Whereas really going into a grocery store, you really don't have a choice. It's a matter of which grocery store you're going to. And truthfully, the same thing about pharmacies. A lot of grocery stores now have pharmacies. So I'd like to see it cleaned up a little bit where it would be grocery stores, pharmacies, and all medical, dental, which I think is already going on. Eliminate the banks, and then the all city-owned, of course, that's going on now, cat bus, et cetera, and then also the taxis, et cetera, just to kind of clean it up just a little bit from that perspective. The last thing I want to say is this. I thank you, Catherine, for what you just said, but we got to remember, I believe, and Mary, I think I had asked you this, you may not know the answer, but I believe if we were to enact any form of a mandate that's not related to schools, we will probably be the first community in the state of South Carolina to do that.
I did look that up, and I'm sorry, I forgot to bring that up. I did a chart of about 6 or 7 places that had some format. Richland County applied to schools. Columbia is a little bit broader, but there were some other places, and I'm sorry I didn't send that to you. I didn't finish it. The South Carolina Department of Emergency Management during the last surge had a place on their website. You could just click on it and it would show you every municipality, every local government mask ordinance. But they don't have that going right now, so I guess that sort of makes your point that they haven't started. Now, we haven't seen the numbers that we've seen until like the last 10 days, and today's number, of course, was over 5,000 new cases in the state. So I imagine that will be something we'll see soon, but I think you're essentially right, except for I had about 6 or 7 entries, and I included Clemson. College of Charleston has added a mask requirement, and USC.
So where I was going to go with that, we've got to remember one thing about our community. Whether we like it or not, we're somewhat of a tourist attraction. And so when we set ourselves up with a really tight mandate, then what we're doing is 2 things. Number one, we're going to have people coming in here that are not operating under a similar mask mandate, so there's going to be some confusion from that perspective. And I think from a business perspective, and I clearly am looking at it from that standpoint right now, are we going to discourage people from coming as we tighten this thing up, particularly when we're out of line with everything else that's going on in the state?
I would agree with John as far as, to me, grocery stores. I mean, pull out the gas stations, you can pay at the pump, you have brief limited interactions and stuff like that in there. Banks, yeah, we have drive-thrus, we have ATM online. Not everybody has access to online. You have to be conscious of that. But the drive-thru, and people walk through the drive-thru when they need to as well. It's been that, maybe one time it was discouraged, but in the last 20 months, that certainly has become a little more prevalent. A lot of these other ones are redundant, so I mean, I don't see where it really hurts to leave them in or take them out as far as city-owned buildings, because we're already doing that. I believe Cat Bus receiving federal funding, they already have a mandate, so we're kind of restating a few things. So I would just point that out in there as well.
I included those so that it would be more publicly. I didn't want them to think, okay, the city's doing whatever it wants to do, but we're complying with these things too. That's why I put those in there. Also, we contract with Senior Solutions, and there may be other publicly funded transport, and I felt like they should comply just like Cat Bus.
Also, I mean, I'm kind of indifferent. I'm just kind of, I guess, the point now that these things are already being done and already out there, so that's not really something new coming from this if we move it forward.
I did put the taxis and the Ubers because there are many members of our community that don't have vehicles.
But, you know, where I disagree with Dr. McGuire is that, you know, if you're going to pass a mandate, I do believe it's fair to limit it to the essential services because people do have to go there. There's other places you're going in by choice. And I do appreciate the fact, and I guess Andy has already, if it were to pass, it would become a standing policy action item on the agenda because one word that resonated with me from Dr. Swan was there will be boosters eligible in September. So even from an essential service standpoint, I feel like it becomes more of a choice once you have boosters and chances to further build your immunity as well. So I just want to make sure we keep sight of that also. But, you know, whenever we get ready to move forward on this, I'd certainly like to make a motion to change, a secondary motion to change, to reduce the scope of these essential services. And we get to that point after everyone's had a chance to speak.
I guess my question is, are we saying not to have grocery stores, or are we saying leave
No,
grocery stores?
grocery stores, but not the other items. Okay. Not the convenience store and not the produce stand.
The reason I put convenience store in there was because there are people in our community that's their primary grocery
I was
store.
getting ready to say, we have to leave the convenience stores in because we make assumptions that individuals all shop at grocery stores, and a lot of the convenience stores is where some folks have to shop or do shop because that's either close by or what can be afforded, what they can afford, or that's where their needs are. And so it's still one of those areas that is considered essential in my opinion. And to take that out, and then produce is also because I don't think it's fair to say not to have produce when they may want fresh vegetables just like, well, fruit like anyone else. People who may want to go to these stands. And so I want to be mindful of populations that typically may not use your typical stores. So that, to keep that in mind. And I do, Fran, I understand your concern too, and I am concerned about what our non-essential locations are. However, to Catherine's point, I also think that this gives us an opportunity to start here initially, hoping that if we can get the essential services and start wearing masks in those establishments. The restaurants and other places said that they could manage their businesses and require masks if they choose to. But some of those businesses, are having to close because of COVID, and that's a choice that they're making. That's going to, in some way impact their businesses. And so that's the choice that they're choosing to make, and that's up to them. But to give them that opportunity. But my thoughts are, if the numbers don't get any better, then I, like Catherine, believe we can start to make that mandate a false. I know one day is too many. I hear you. I totally agree with you on that. I do. But if we want to at least start to impact it in some form or fashion, I know the best way is to deal with the essential establishments first and foremost, and then if we have to, the non-essential. But I think we at least owe it to those who really need these services, don't have a choice.
I'll chime in. Based on Monday night's discussion, I feel like we were, the main design was to protect our youth and our at-risk by requiring masks in essential places like schools, grocery stores, pharmacies, and medical practices. So it's simple, understandable, that would allow those at-risk members of our community to take care of essential needs in a masked environment. So to what I would assume both the two Johns, to my right and left, I would validate exactly with the same thing because I feel like we're protecting the youth. We've already done that. And we're looking at also protecting our most vulnerable as well.
So, Robert, let me just say this though. First of all, I disagree. We're not a tourist town, we're a residential town. People live here. 16,000 people or more live here. And out of all the comments I got on this, 28 said we need an ordinance, and many of them, not all, pushed it beyond the school. The 4 people said we don't, are business people, and my guess is some of them don't even reside in the city. So I think it's not accurate to say that this is a move that the city wants. I don't think it is. But let me just say one other thing. If it was possible to track the progress of COVID virus, and I saw someone who got that COVID virus from someone who they got it in one of these non-essential places, and I was sitting in their hospital room watching them die, or in ICU watching nurses have horrid experiences, I would say to that person, I am so sorry. Is there anything I could do? Well, unfortunately, you may not want to hear this, but right now, this is something we can do. We can vote masks are mandatory. A little minor thing we're asking people to do, wear a piece of cloth on your face, and we can continue to make accommodations and expand that. And instead, we are going to wait for that COVID virus to pass from one person to another, possibly with the most tragic outcome possible. And believe me, I would say, and you would say, that is awful. Can I help you? This is the time to help people. Our responsibility is to help people. And to back off from that, even if it's only one person, one 6-year-old or 60-year-old, we can, in very simple ways, protect people and the source of the danger they experience at minimal expense, frankly, even if it's only 2 or 3 weeks, minimum nuisance, just by raising your hand one way or another. Is there anything I can do to help? Well, now is the time to do that.
Other comments?
I'll make a secondary motion if we're ready to. And my secondary motion would be that we do strike convenience stores. Alicia, I hear what you're saying on that. I just feel like there's a opportunity, it's a brief interaction when people go to convenience store as opposed to other stores in there.
Wait, strike which one?
The convenience stores and banks as well, because the drive-through, whether we walk up or drive-through, an ATM service are certainly both available. We like to think of ourselves as essential, but we're not always needed in person.
Do I have a second? Do I have a second? Okay, I will second that. All right, further discussion? First, we'll go with the amended motion at this time. Oh, sorry.
The only thing
Robert, I would like it to be a roll call vote, please, a roll call vote.
Okay.
The only thing I was just going to say about the convenience stores, I mean, I think we're splitting hairs a little bit there. I get where Alicia's coming from, particularly from some of our historic neighborhoods, because they're extremely convenient. I hadn't thought about it from that standpoint. I mean, they're walkable for those communities, and a couple come to mind that again I hadn't considered. So I can think of the one at Red Hill. I can think of the one right there at the corner of Berkeley that serves that neighborhood back there. I can't think of the name of it anyway. So there are several of them along through there. And again, I apologize for not considering that. So that's one reason I made that comment.
I mean, you can certainly amend it to just the banks if you want.
I'm sorry, I can't hear you.
So you can amend it to just the banks if you want. I was just saying.
Right. Okay. I don't know how. I mean, if I did that wrong, I don't know.
Wait, you can.
No, I'm saying you can do that if you want to.
You can amend it just to remove banks. If that's what you can.
Okay. Well, then I further amend the motion to just.
Mary, you're gonna have to keep me on track. Yes, ma'am.
I further amend the motion to exclude banks only.
Okay. Do I have a second for that?
Second.
Any further discussion on that?
So you'll vote on that motion
Yes.
first.
Yeah. All right. So we have a first. Any other discussion? And there's been a call for vote. So on the amended motion, just to remove banks, all in favor, raise your right hand.
Roll call vote, Robert.
Fran, I haven't got any opposed? And
Me. Oh, me.
I'm sorry, okay, Fran, that was a nay vote? Okay, all right.
Now
Now,
we'll
Mary,
go
you
to-
want to take?
And I'll withdraw my motion. I mean,
Okay.
That's fine. Then
Well,
if he
actually,
withdraws it-
once it's been seconded, you all have to vote on it.
Okay.
So, but it may be a moot thing, so, you know, I mean, that sounds kind of ridiculous, but it belongs, once a motion is made and seconded, it belongs to the council rather than to the movement.
Okay. So,
Robert, look, can I interrupt again? Mary, tell me if I'm wrong. Point of order. I believe any member can request a roll call vote, which means a verbal vote identifying who voted that way. And I requested a roll call vote, please.
This will be a roll call on which motion, the underlying motion or the?
Whatever we just voted on. I'm not sure which. The first vote of the night, of the afternoon, just now.
Okay.
okay, the first vote was an amended motion just to exclude banks from the current.
Right. And that should be, I think I requested a roll call vote by
He
name.
wants to know how everybody voted. Am I hearing correctly?
I think that's fine. If you,
Well, I want everybody to say their name and how they vote, which is a roll call vote.
Fran, I think you did that before the second motion was made, though, so it would be on this vote. I'm 99% sure.
Well, I said that, maybe you didn't hear me, but I said that before the vote, Bob. I said it immediately when the motion was called.
I didn't hear you say, I didn't hear you.
the last motion was solely to amend John's motion, and now this motion will be John's motion to amend the underlying proposed ordinance, and then the third vote will be on the ordinance itself. And I think you can do a roll call on any of them that the chair chooses, because it was a little up to me, and it kind of caught Dr. McGuire off, he was kind of in the middle, so to avoid any arguing later on, why not do a roll call? I mean, everybody saw who voted, so you might as well do that on each element.
Okay.
Just so the record will be clear. Is that okay, Dr. McGuire?
Yes, that is.
All right, so.
So
do you
on,
mind
I'm
taking-
sorry, sorry. On Mr. Fulmer's motion, do you want to do a roll call just of who voted on what, since they've already voted?
Okay, so I'll do a roll call. John, how did you vote? Is that how we were doing?
I voted yay.
No.
Kathy?
No.
Yay.
Yay.
Nay.
Yay. Okay,
And
now,
then Fran.
and then Fran.
Nay.
Okay, now we'll go to the first amended motion that was to exclude convenience stores and banks, if I'm not.
His motion now is just to exclude the banks.
No,
We just voted on that.
banks.
No, but you made that his motion, and now we vote on his
We
motion.
had to vote twice to make it
Right.
official now.
So
You're
now,
supposed to make the change, now we're voting on it.
So,
It sounds ridiculous, but this is actually how you do it.
I
You
know.
do them in order of the intermediary motions.
All right.
His motion amended John's motion, and now you vote on John's motion.
so now the only thing that's different is that the fourth bullet item that had banks is out of it. So now we're voting on
Removing that.
Well, now we're voting on
remove that item only.
For the second time we're voting.
Yes.
Okay.
Yes.
Any further? Okay, all in favor, raise your right.
Fran, wanna
Do a roll
You want a roll call? We'll do a
call?
roll call. Okay, we'll go around the room from my right to left. So John, please.
I think I voted yay.
You need to be certain.
And I voted nay.
Yay.
Yays as well.
Nay.
Yay.
No.
Okay.
Nay.
Now
Now,
vote on the ordinance itself if there is no further discussion.
Okay, now we're on the original ordinance as written that you have in front of you. We're voting on that ordinance as well, and I will do a roll call unless there's further discussion.
So, Robert, before you call, so you're talking about the entire ordinance now, or just the section we had amendments on? What are we voting on now?
It'll be
The entire ordinance.
the entire ordinance applying only to section B of the essential locations.
So it's not on the whole ordinance, it's just section B?
No.
Yes.
I'm confused now.
That's the changes we've made. So we've taken out D, which is the schools, and we've taken out banks.
So, I'm not sure, but again, I have another concern with the ordinance. It's the notion of large gatherings without requiring masks. Again, I think large groups of people, even outdoors, vaccinated or not, none of whom are wearing masks, is in fact a spreader. And if we don't put some limit on outdoor numbers, not only is that a spreader, but that is the story and the picture that will be nationally shown. 500 or 1,000 or whatever, Clemson residents, shoulder to shoulder, arm to arm, wherever it happens to be. So I would like us to, actually I have some other amendments too, but I would like at least a discussion on the notion of mask. Let me bet. I'm going to make a motion, if I can, Mary, that we limit or require any mass gatherings that people there have to wear masks. Mass gatherings more than 100.
So there is a motion. Do I have a second?
What is the, could somebody summarize that motion for me a little bit?
Okay, so, go ahead, Mary.
It's masks for large gatherings, Fran, am I understanding that correctly?
Right. That if we have large gatherings, and I'm defined as 100 people, that there is a mandatory mask requirement for people at that gathering.
So if everybody heard, do I have a second on that amended motion? Okay. We will go back to the original motion. I'm looking at Mary just to confirm. And any
I have another amended motion though, Robert. I don't know if it's time, and that would be that we eliminate the difference between essential and non-essential businesses and require masks in all Clemson businesses.
Okay, there is a motion for all Clemson businesses. Do I have a second? Okay, we will go back to the original draft ordinance again.
Robert, may I ask one question?
Yes.
And if it's in here somewhere, forgive me, but I do think maybe in the ordinance we should have something, or what did we do last time, about revisiting this every 2 weeks? Because I'm gonna defer to John Duckworth and say we need to be on deadlines.
Well, it just needs to be on every policy action item for every meeting we have.
At City Council, which is the first and third Monday of each month.
Yeah,
So that doesn't need to be.
I don't know that it has to be in the orders, but I think any council member can ask the administrator to put it on the agenda. So,
Okay, I'm good with that. I just want to make sure that we stick to it.
And that if circumstances warrant, that we would call a special called meeting if we need to do it in between.
Okay.
All right. Now we're back to the original draft ordinance as written. Is that correct, Mary?
I think so.
Written as amended.
Yes, yes.
Written as amended, excluding banks. Okay.
And Robert, I would like this to be a roll call vote also, please.
Okay, yes, sir, we will. Any other further discussion? I'm gonna turn it around. We're gonna go left to right this time. So, John.
Make me go first this time.
Yes, I am.
I'm going to vote yay for the limited one, and I'll just make my comments to it too. I think we all need to explain our vote here a little bit, because I for one, have been pretty much all on the schools. I think Dr. Swan's discussion of the waning of the efficiency of the vaccine over time, and the fact that we will revisit this roughly in 2 weeks, would allow me to move forward on the essential services only, which is what's proposed in here, because people don't have a choice to go in there. Otherwise, you're making a choice to go out and eat, have a drink, go into a social gathering, whatever. So I feel like we should give a little explanation on those two.
Okay, and Fran?
So, no, and if my explanation again, I think I've already given it, is our responsibility to the health and well-being of our residents. I think we fail our residents if we vote in favor of this. In 2 weeks, again, you might unfortunately have lots of chances to say to people who are sick, dead, lose a loved one, I'm sorry, if I'd only known.
Alicia?
I'll vote yes to pass this. Let's move on again. Yes, simple, because I think it's important to protect our community. And bypassing this mask ordinance, I think this is exactly what we do.
And I'll vote yes as well. It's protecting our most vulnerable citizens through the essential services. Bob?
I vote yes as well, but I do want to go on record saying that I do hope businesses that are non-essential do take this seriously, do require masks where it's not a major effect on their business. I understand it for bars and restaurants, but do know that if the situation does not improve or if it gets worse, I will likely be looking at additional mask mandates. So please work with us, and even more importantly, please continue to encourage people to get vaccinated, since that is our best defense and way out of this.
Okay.
I vote yes, and I will defer to what Bob said, exactly with the addition that we are not changing anything about how often people are open, when people are open, who can go in, what you can serve, none of that. It's a mask, and I think it is a logical first step.
And I vote yes as well, for a lot of the same reasons, and I do agree with Bob and Catherine on this. I think that Athens, actually does this. They allow businesses to opt in, and so I would encourage those that feel like it's not an inconvenience to require or suggest strongly that people do wear masks.
Okay, and then I'm going to go to the last item on our policy action. We will go back to, if we want to still submit the letter of support. We did not fully authorize that. Monday night, and if we feel like we still need to do that, I will defer to city council, and I still don't have it in front of me. I apologize, I did not bring it. I thought it would be, so, sorry. But, yeah.
I think it's good to show our support to the school districts. We don't know what's coming down the road when the legislature acts. And while we didn't take formal action, I'm gonna make it in the form of a motion now, because I feel like there was good consensus.
Okay.
So I would make a motion, we send a letter.
I'm sorry, just make sure you change your words from mitigating.
Well, as I say, I will let y'all reword it, but the portion where it said the support the efforts to move virtual, we change that, probably worded to we support any mitigation efforts that the school district would have during this time.
Do we have a second for that? Okay, Catherine, thank you. Any further discussion?
We're sending the school district and the state.
That's actually, put it on to the
We'll
governor's.
do it again to send it to Pickens County as
Wait, it's
well.
on the agenda, I'm sorry, the school district.
Yeah, we have it right now to the county district, Pickens County School District, as well as the governor's office. Any further discussion? Okay, all in favor, raise your right hand. Any opposed? Fran?
I'm in favor.
Okay, thank you. All right, unless there's no other items,